Good afternoon, in 5 minutes. Thank you all for taking time. We'll be getting underway. I'll make some opening comments. You'll then hear from Jason Helgerson as the New York State Medicaid Director. You'll then hear from Ken Rasky, who is the President of the Greater New York Hospital Association. Then B. Grouse, who's the President of the Healthcare Association of New York State. Then George Gresham, President of 1199. We just finished having a meeting with a larger group of healthcare providers from across the state, talking about the impact of the President's budget and the ACA Replace and Repeal Act. It has dire consequences for New York, and we went through that briefing, and we want to discuss it now with you. Let me go around the table just so you have an idea who's here. Jeff, why don't we start with you?
Jeff Kraus from Northwell Health.
Dave Scarpino, Health Alliance, WNC Health.
Steve Safier, Montefiore.
Jill Farello, New York State Nurses Association.
B. Grouse from the Healthcare Association of New York State.
Jason Helgerson, New York State Medicaid Director.
George Gresham, 1199.
Ken Rasky, Greater New York Hospital Association.
Kathy Wild, Partnership for New York City.
Kirk Adams, Director of the Healthcare Education Project.
Candace Johnson, President and CEO of Roswell Park in Buffalo.
Ken Koshansky, I'm Senior Vice President for Health Sciences at Stony Brook University.
Reuben Pasnak, CEO, Stony Brook University Hospital.
Bob Challoner, CEO of Southampton Hospital.
Thank you. First, my greatest fear from last year's election has actually come true, which is you would have a rabid conservative ideology in Washington that would tell New York to drop dead. And that is exactly what is going on. You have a Paul Ryan, ultra-conservative Congress that has been talking about making dramatic changes that would be devastating to New York for a long time. President Obama, frankly, held Paul Ryan and the rabid conservatives in check, and now Paul Ryan has been unleashed. And what you're seeing is the rabid conservative orthodoxy that he's been speaking about for years. First, the budget that the federal government is talking about passing would be devastating to the state of New York. It does everything we were afraid of. It cuts low-income housing. It cuts the food stamp program. It cuts community development block grant money. But it also cuts taxes on the richest 1% of Americans to the tune of $150 billion. Second, the Affordable Care Act, repeal and replace the Affordable Care Act because it's terrible. We were told no American would lose their insurance. That was the promise. They'll do the repeal, but no American will lose the insurance. Now the Congressional Budget Office says 24 million Americans will lose insurance and 2.7 million New Yorkers will lose insurance. Then they said, well, when we do the Affordable Care Act, we won't hurt the states. We'll block grant the money to the states so the states have flexibility. But don't worry, we won't hurt the states and we won't hurt the people who need help. Well, they have, very, very badly. There was an expression during the Reagan years, President Reagan years, that the Congress wanted to pass the buck without passing the bucks. What did that mean? Pass the buck in terms of responsibility to the state, without passing the bucks, without passing the resources, so the states could actually provide the care. That's exactly what they've done here. With this cheap rhetoric of the government closest to the people knows best, they're going to defer to the states and block grant to the states to do health care, but then they cut the funding that New York has been getting to the tune of $4.6 billion over 4 years. $4.6 billion is a devastating financial cut to the state of New York. And if that wasn't enough, there is an amendment that has now been introduced by two Congress people, Collins and Faso. What that amendment says is the counties no longer have to contribute their share to fund Medicaid. Historically, Medicaid was funded in this state 50% federal, 25% state, 25% from the counties, locality. This amendment says the counties don't have to pay. That means you cut Medicaid even more when you take off the county's responsibility. It would be an additional $2.3 billion cut to Medicaid. And that's just in the areas in upstate New York and Long Island. That's where the amendment is effective. New York is the only state in the nation affected by this amendment. The only state in the nation. And it is cheap politics at best. Because what the Congress people say is, well, if the county doesn't have to pay their share, then the county can reduce taxes. Yeah, what they leave out is, if the county doesn't pay its share, there's another $2.3 billion cut to Medicaid on top of everything else, and that means less people are going to get health care assistance. That means more hospitals, more nursing homes are going to close. That's what that means. There is no ferry that is going to float down and hand over $2.3 billion to make up the shortfall that the counties left. If the federal representatives wanted to say, well, the county share is going to be reduced, but the federal government is going to supplement it, that would have been one thing. But this is just, we're going to also take off the county's share, and nobody will make up the difference. The consequences will really be devastating to the state. $4.6 billion, then $2.3 billion in upstate New York and Long Island. You will literally decimate the healthcare industry. We've been working very hard in upstate New York to bring back the economy. You have no economy without a healthcare industry. You would lose more jobs in this proposal than have been built and brought to this state over the past 5 or 6 years. The consequences are really that dramatic. It is also inconceivable to me that these Congress people can justify how a federal representative goes to Washington to represent their district and actually winds up hurting the district. Between the federal budget that cuts community development money, cuts low-income housing money, cuts home heating assistance, and now decimates health care for hundreds of thousands of people in this state. In Representative Collins' district, there are 100,000 people who receive Medicaid. In Faso's district, there are 150,000 people who get Medicaid assistance. How about them? What happened to putting people before your politics? Rather than swearing allegiance to the Ryan radical right, why didn't they think about representing the people in their district? Why didn't they think about the oath that they took and put their politics aside? That's what this is about. They've declared war on New York, and this is just the beginning. It started with health care. You're going to see it with the budget that disproportionately hurts New York. You're going to see it with their talk about ending state and local tax deductibility. It is nothing short of a targeted war on New York. Again, this Collins-Faso amendment, there's only one state in the United States that it affects. That's the state of New York. It cannot be. Jason Helgerson will give you some of the numbers and facts about the consequences for the state. Jason?
Well, thank you, Governor. And it's true that this act is a cynical ploy that is going to affect millions of New Yorkers and millions of Americans. Recently, the Congressional Budget Office came out with its official score of this act. And the numbers are staggering. 24 million Americans will lose health insurance access as a result of this, the biggest single step back in healthcare access in our country's history. 2.7 million of them will be our fellow New Yorkers. What's also unfortunate about this particular act is that it will fall hardest on the individuals who are of greatest need in our communities. It will fall hardest on those who are older, and it will fall hardest on those who are sick. And just to give a couple of examples of what this Ryan plan means is that for those individuals who are in those groups, the older, the sicker, they will see their insurance premiums skyrocket in the coming years. And I'll give you a couple of examples of that. But at the same time that we're going to see those individuals far worse off under this act, we are giving a massive tax cut to the wealthiest in our country. It's in essence a reverse form of Robin Hood, where we're going to literally take from the poor and the sick in this country, in this state, and we are going to give it to our wealthiest citizens. One example is a 55-year-old non-smoker who will see its premium basically double under this act. One can also go to the actual CBO score and see an example of a 64-year-old just living above the poverty line who will see their income, their premiums go from $1,700 a year under the Affordable Care Act to $14,000 under this new law. I mean, and as a result of that, what we will see is there will be fewer people insured, and unfortunately, we'll see a severe human toll as a result of this act. Next slide. Next slide. So in addition to what was in the original act that we've all had a chance to look at is the amendment that was basically released in the middle of the night last night, which is the manager's amendment, which includes within that this Collins amendment, which basically takes away the ability of New York State and New York State alone to be able to utilize local tax revenues, as we have since the Medicaid program was created in the 1960s, to support our program. That's the nature, the history of our program, and the impact is $2.3 billion loss. So it affects all the counties outside of New York City, and here are the impacts by sector. As you can see, nursing homes, home care, and hospitals all significantly affected as a result of this particular proposal. So when you add the $2.3 billion to the $4.6 billion number, which was the number the governor mentioned originally, which was our initial estimate of the effect of the act, you have an aggregate impact to the state of New York of almost $7 billion. As was mentioned, a significant percentage of the population in New York State is affected by this. You have affected not only the Medicaid population, but also those who have benefited from other programs created under the Affordable Care Act. And in the congressional districts of Congressmen Collins and Faso, it's 250,000 people. As you can see, this slide gives you the breakdown by those two congressional districts. Here are the other congressional districts in our state, and you can see the numbers are staggering. Tremendous numbers of individuals. In Seoul, 7 million New Yorkers rely on these programs every single day. That's more than a third of our total population. 1 in 3 people in our state rely on these programs that were created or fostered under the Affordable Care Act, and now we'll see impacts across all of those programs, some of them even eliminated under this act if it were to become law. As the governor mentioned, historically in New York State, this was a local and state partnership relative to how our Medicaid program was structured, with the federal government picking up its federal share of 50%, with the state and local governments spreading that cost. And you see a lot of concern and talk over many years about that. But what has been missed is the fact that we've made tremendous progress in reducing the local share. Now only 13% of the cost of Medicaid is covered by the counties, much reduced as a result of, particularly thanks to Governor Cuomo's leadership in the recent years. And so as a result, while it is a part of budgets, it is a capped part. In fact, it has declined because of the Affordable Care Act. And that fact is really lost in all of the rhetoric around this particular amendment. A key part of this, too, is that you'll hear from some of the proponents of this that the Medicaid program in New York is too big and it hasn't done enough to become efficient and to provide more cost-effective care. That nothing could be farther from the truth. New York's Medicaid program has been nationally recognized, and in fact, we've shown that we've been able to contain costs. In fact, over the first 5 years of the Medicaid redesign team convened by Governor Cuomo in 2011, we've lowered total cost of the program by $34 billion. We now spend less on a per-person basis in this program than we did in the year 2000. We have, in fact, bent the cost curve, and we've done it by we haven't taken a single benefit away from a single New Yorker. In fact, we've expanded the program and reduced our uninsured rate and cut that uninsured rate in half. So if you want to join the fight, here's one way to do it, and happy to answer any questions when we get to that point.
Thank you. Thank you very much, Jason. Next, we'll hear from Ken Rasky, who's the president of the Greater New York Hospital Association. Ken?
Thank you, Governor. The Greater New York Hospital Association has had a long history of working with our colleagues in government, with you specifically, Governor Cuomo, on ways to contain costs and at the same time achieve excellence and access to the population in terms of health care. And great strides have been made, particularly in the cost containment and the access issue. A lot of that, particularly on excellence and as represented by the individuals around this table in medicine and access to those very same institutions, is deeply jeopardized by this bill and the doubling down that the amendment has on top of it. So the numbers that Jason Helgerson put forward are very real, and they're tragic by any stretch of the imagination. If we start translating those numbers into impacts, what are we going to see? Well, we're going to see that currently we have 27 institutions, safety net institutions, scattered all around the state, are going to be jeopardized in their ability to continue to do business. They have a high probability of failing and closing. In addition to that, those that are not there will find substantial pressure to downsize because the financial pressures will just be too enormous not to. As a result of that, we're going to have a dumbing down of the quality of care and an access problem that we have never seen before. And this amendment, which doubles down, as I said, on the impact, is extraordinary. And I personally, Governor, I want to say this to you and to the public. I want to make this as perfectly clear as I possibly can. How two congressmen from New York State can support an amendment that doubles the impact for all practical purposes of an already bad bill on New York State residents is unconscionable. And I stand by that statement, sir.
Well said. Thank you, Ken. We'll now hear from B. Grouse, who's the president of the Healthcare Association of New York State.
Thank you, Governor Cuomo. I'm honored to be here and want to thank Governor for bringing us all together this morning. I applaud you, Governor. You've got it right. Your strong stance against this bill and the Collins Amendment is the right thing to do because this bill and the amendment poses a huge threat to every single New Yorker. The Healthcare Association of New York opposes the bill and the amendment, but also, in fact, the American Hospital Association, the American Medical Association, and virtually every national provider group, doctors, nurses, hospitals, all oppose this bill and this amendment. There's a reason for that. This bill will hurt coverage, particularly for low-income New Yorkers and low-income Americans, and it jeopardizes care for those who need it the most. I think, as Jason said, we have been working for years to help make healthcare more affordable, make it more accessible, and this bill takes us backward. It takes us in the wrong direction. And Governor Cuomo, you also got it right. You can't have a thriving economy without a thriving healthcare system. And this bill, particularly the Collins Amendment, will devastate healthcare in non-New York City counties and in New York counties, but the amendment in particular will hurt rural counties and places like Buffalo and other areas. So we've got to make sure that it doesn't happen. And I think, again, I think the care will be jeopardized and jobs will be jeopardized, I think, if this continues to move forward and we're not able to continue on the path that we have been able to continue on with making healthcare more accessible for everyone.
Thank you very much, B. Batting cleanup will be Brother George Gresham, President of 1199.
Thank you, Governor, for convening this meeting. I think that it's ridiculous that we have to be here today. I will say America in general, and New York in particular, has been sold a bill of goods. The American Health Care Act, unfortunately, is just what it says. It acts as if it's taking care of America's health care, but in fact, it does not do that. It hurts the most vulnerable, those who need health care the most, and for the benefit of what? For the benefit of those who are wealthy enough to take care of their families will never have to worry about the health care that their family receives, as well as our Congress people. Ask any of them, do they have any health care problems or concerns that they must worry about? No, because thanks to the American people, they have universal health care. I think that we have been betrayed in New York by the two Congress people that of all the things that they could do, they take away an industry that New York is particularly proud of and famous for. Healthcare to New York, it is what the auto industry used to be to Michigan. We have the best renowned healthcare in the country. We make sure, as you've heard the report, that people who were very ill are getting better. Our statistics are going up. And all that this does is to reverse all of the progress that we've made forward, to put it back to the days when the way to see a physician is to go to the emergency room and get emergency urgent care. That is not necessary. That is not the way a civilized society works. I am certain that is not the way those who voted for those representatives expected that they would represent them in Congress. And so I'm urging all New Yorkers, call your representatives and tell them to make sure they vote no on the American Health Care Act, because it is only an act.
Very good, George.
That's why he bats cleanup.
That's right.
Thank you, George.